Welcome everybody to our question and answer session this morning. I'm just going to introduce you to some of our experts this morning that are on the call to answer your questions. Please feel free to put things in the chat box as we go along. I'm going to start with Tim. Would you like to introduce yourself?
Good morning. Thank you, Christine. Good morning, everybody. My name's Tim Weller and I'm Head of Integrated Quality Service at Norfolk County Council and Norfolk and Waveney CCG.
Thank you, Tim. And David.
Good morning, everybody. I'm Dr. David Goldster. I give some clinical support for care homes to the CCG.
Thanks, David. Janine.
Good morning. I'm Dr. Janine Smell. I'm a GP in Norwich and Clinical Director for Norwich PCN, and we're running the 3 vaccination centres in our PCN.
Thanks, Janine. And may I say, doing an absolutely fantastic job for care homes and for staff in the area. Absolutely brilliant. Thank you, Janine. Can I go to Judy? Judy Ames.
Hi everybody, I'm Judy Ames. I'm one of the infection prevention and control nurses for Norfolk and Waveney CCG.
Brilliant, thank you, Judy. And can I go to Hannah?
Hi, I'm Hannah Clark. I'm a project manager working for Norfolk County Council, supporting around some of the comms for the COVID vaccine.
Brilliant. And Gemma?
Hello, good morning. My name's Gemma Vokes. I'm one of the Care Provider Quality Improvement nurses working at Norfolk and Waveney CCG. Thanks,
Gemma. Thank you. And then I suppose I really ought to introduce myself and also Megan. So I'm going to introduce Megan first. Megan, would you like to just introduce yourself?
Yes, I assume you mean me.
I do indeed.
Okay. I wasn't sure if there was another Megan. Hi, I'm Megan. I work for Norfolk and Suffolk Care Support as their communications and admin executive.
And does an amazing job. Thank you, Megan. And for those that don't know me, my name is Christine Footer and I'm the Chief Operating Officer here at Norfolk and Suffolk Care Support. So welcome everybody to the call today. And we'll start. Tim, would you mind sharing your screen or doing whatever you wish to do in your presentation?
Yeah, you'll just need to let me know when you can see my screen. I think you should be able to see it about any time now. Okay, perfect. And I can see you, Christine, but I can't see anybody else. So if there's any questions in the chat, it'd be great if somebody just alert me to them and I'll see if I can deal with them on the way through. What I've been asked to do today is to give you providers an insight into what we're doing next as a quality assurance service, because we are starting to go back into business as usual, and that's a bit of a scary concept for everybody, particularly us actually. We have had a little go at doing some actual visits with providers. The feedback has been really good, but it's been good for us to sort of find our feet again after having a whole year off of doing PAMs and quality monitoring visits. But I wanted to give you some assurance about the way we're going to do that going forward, based on some of our recent experience of doing that with the sector. First of all, to say why we're doing it, and here are the CQC ratings for March. I did look this morning just 10 minutes before we started, and CQC, although it's 10 hours into April, they still haven't published the current ratings. So these are last month's, and as you can see, this is the picture of compliance across the county. This is part of the reason why we need to get back out to start support providers to make improvements to make their services compliant before CQC turn up. So this is the picture from last month. I would imagine it's going to be rather similar for this month as well, but you can see that almost a quarter of providers in that RI inadequate bracket, which is not where we want it to be. We want much more of them to be, much more providers to be in the compliant brackets of outstanding and good. So this is part of the reason why we're moving forward to this. And why now? So one of the reasons why it's now is because we did a lot of work around December 19 to expand the functionality within our team to be able to conduct more PAMs, to be able to come out to more of you more often, and then we had a pandemic. So all of the restructure that happened within the commissioning directorate of Norfolk County Council, but particularly within my team, had kind of then swung into a different mode of action, such that we weren't really able to utilise any of that new functionality that we had. So the reason we're doing it now is because it feels safer to do it now than it has done over the last year and a bit since we've had a pandemic. But this is part of the structure that we set up at the end of December 19. So we've increased our capacity to the tune of 4 quality monitoring officers. And by the way, if there's anybody looking for a job at the moment, you'd notice we're advertising. We've got somebody on secondment at the moment into another part of commissioning directorate. So we've got a vacancy for 1 year for a shameless plug if there's anybody that wants to come and work with us for 1 year. So so we really want to get back into doing some of the stuff that we'd set out to do to support the market right back at the end of 2019, and so this is our opportunity to do it. Another reason why now. So from the visits that we've been conducting over the last year, it sounds a bit like a Whiskers advert, but it is actually true that actually 8 out of 10 providers did say that their homes preferred actual visits to our virtual quality monitoring visits, and we have been visiting virtually, and we've been having a look at a lot of ceiling roses and a lot of carpets and a lot of corners of rooms, because it's quite difficult to do virtual quality monitoring visits when somebody is on the end of a phone trying to get everything into view. We recognise there's some technological issues with Wi-Fi. We recognise that there's parts of the county where it simply doesn't work at all, parts of some buildings where it doesn't work at all. So providers really like to have us. The feedback that we've had, at least, is that providers would much rather we were actually there as long as we could do it safely. So that's one of the reasons. Of course, the other thing is we can actually get much more meaningful information when we turn up. One, because we can speak to people in a more normal way than when they're sitting behind a screen, and particularly we're talking about engaging with people that use your services, and some of those people really do struggle to interface with IT. So we really like to be able to meet them face to face, albeit socially distanced, albeit behind PPE, but to get their views that way. And so that's another reason. We do also need to just face reality. At some point, we need to start thinking about how we're going to start doing things in whatever the new normal way is again. So this is a time where we're going to start to do it with a view to increasing our capacity, increasing different ways of working, thinking about different models for collecting the sort of information that we did pre-pandemic. But we do need to think about how to get back to business as usual. So this is the time where we're starting. And of course, we mustn't forget that we've also got our duties. We do actually have a statutory obligation under the Care Act to assess the quality of the services that the council commissions. So over the last year, we've been trying to achieve that in a virtual way. We don't think we've been able to do it as successfully as we could have done, and this is why one of the reasons why we want to start to get back to do it in a more normal way. And as I said earlier, we really want to get to you before CQC do, because we recognise, as providers have, that we do offer value, in the sense that we're that extra pair of eyes who, when particularly over COVID, when you've been looking at your services in a really different way, you've been looking at your services really focusing on IPAC, and I guess that maybe lead to this final dot here, that actually your focus has been on infection control, as it should be, and we're looking at wider quality issues as well. And sometimes your views can be quite narrowed when you're focusing on really important issues like infection control, and to have those fresh eyes, our eyes, in to support you to identify some other things that may need your attention now, could, we hope, be useful for you as well as for us. So they're just some of the reasons why we're doing it now. So how are we going to do it in a safe way? Well, for every single visit, we will have, as we always expect you to have, comprehensive risk assessment. We also have one. So we're working with Norfolk County Council health and safety team in devising our comprehensive risk assessments for COVID, and we'll be liaising with you as part of that. So part of that engagement in terms of filling in our risk assessment is to engage with you to understand what the risks are in your services, so that we can do that in a way that makes sense. Oh, I'm just wondering if you've lost my presentation.
It has just gone, yes.
Yeah, because it looks like somebody else has started sharing theirs, and it is Mr. or Mrs. RW.
Oh, I see. Right.
Let me see.
Ruth seems to be trying to share something. That's gone now. So Tim, you should be able to pop yours back up.
Okay, let me have another go. It's because I dismissed Ruth. Sorry, Ruth. But
there you go. That's back up now, Tim.
Have you now got me back?
Yes,
listen,
we have indeed.
If nobody likes the presentation, do bump it. but you know, we want to see a cat or something like that. So people are happy with cats. So this is so we are going to be engaging with providers as part of our risk assessment to make sure that we're aligning with yours as well, which means that if you don't deem it safe for us to be there, then we'll have to recognise some of those factors as well in determining whether or not it's safe for us to do our visits. We'll be condensing our visit as well. So where you might have expected us to be on site for 2 days with the PAMS, you definitely won't see us for 2 days. So we're condensing into 1 day. 1 day is a maximum, and it won't be a long day. So rather in the same way that CQC are condensing their visits, we're doing exactly the same. But part of that will involve us in getting pre-information from you. So we will be asking for information in advance of our visits, which mean that they're all announced. So we won't turn up unannounced, but we will ask you for some information in advance of turning up to support us to prepare that visit, and also to focus us on what we need to look at when we're on site to capitalise on that time. And of course, what you should always expect from us is a facilitative and a flexible approach, which means that we'll be playing by your rules. It's your care home, so we'll be playing by your rules. So what about the people themselves? So every quality monitoring officer that comes to see you, I'll be pleased to confirm that as of tomorrow, I will be one of these, will have received both of our COVID vaccines. So all the team, before they come to visit you, will have received both doses of COVID vaccine. We can give you that assurance and guarantee. Also, in the same way that your staff are required to test regularly, our staff will also do that. So all quality monitoring officers, when they turn up to do their PAMS audit with you, will have evidence of a negative PCR test, which they'll be able to produce in the same way that health professionals would, in accordance with the refreshed guidance for professionals that was released earlier last month in about the 11th of March. So we'll be complying with the highest level of assurance that guidance gives. That's the one that relates to the NHS staff. We'll be replicating that for our staff. We'll of course also be doing your LFD test if that's what you request us to do when we arrive, so that you've got that assurance as well. We'll be turning up with PPE, of course, and we'll be implementing IPAC as you would expect us to, as you would expect your staff to, and we won't be going around licking anybody. We won't also have visited another care setting within 14 days, and that means that each quality monitoring officer will not be conducting any more than 2 PAMS visits a month. We're going to give you that assurance. So in terms of anybody that does become unwell, let's say they did develop any symptoms, we've got time to be able to spot that and cancel any upcoming visits, and we've built our capacity to be able to manage that really well. So it's taken some scheduling to make that happen. It's taken a lot, as we know you do as well when you're working in a COVID world. We've done exactly the same to protect us, protect you, and protect, more importantly, your residents. So that's where we're at with that. Of course, you can expect us to be helpful and understanding. That's what we do. So I'm coming to the end of the slides, you'll be pleased to know. There's only one more after this. So just wanted to sort of sum up where we're at. So I've talked about our what we're doing to recover from COVID-19. The key one is to reintroduce our PAMS. That is a clickable link. So when these slides will be circulated afterwards, I'm absolutely sure. When you find that slide, if you're not familiar with PAMS, if you haven't been subject to a PAMS before, I think many people will have done, but there will be some that haven't. Do click that link. That will take you to the appropriate pages on our website, which gives you lots of information about what PAMS is about. It's rather like a CQC inspection, but it's much friendlier, and we can actually give you advice which CQC can't. So much nicer form of CQC inspection. The other things that we're going to be doing, of course, is beginning to use in more earnest our integrated function. So we've been working really closely with our nurse colleagues ever since the beginning of time. But when we formally integrated in December 19, that's really brought us together and work so that we can work much more closely with you in an integrated way to provide a formal health and social care assurance and improvement service. We'll be establishing working with Norfolk. So Christine, in one of her many roles in her enormously long job title with Norfolk, we'll be working much more strongly with them in the months going forward. Need to draw your attention to the EU Workforce Development Project. I'm sure everybody knows about it already, but it is a shameless plug for them, because really important part of quality improvement is ensuring that your teams, your staff are adequately trained and skilled up for the job that they need to do. And I must draw your attention, if you haven't been made aware of it already, the EU Workforce Development Project, which is providing free training, including developing leaders. A really important component of that is developing leaders, because you recognise that there's a shortage of excellent leaders. We've got some fantastic leaders in the county, but there's also a shortage. So draw your attention to that. We will also this month, it is April, so this month we will be sharing with you our quality and improvement policy. So long awaited, long postponed as well because of COVID, but this month you will see it for the first time. We would like to understand your views on it, because it's draft at the moment, and we want to be able to amend it to make sure that it's fit for you as well as fit for us. We will be robustly contract managing persistently non-compliant provision. There's another way of reading that, and that's that if providers are consistently non-compliant and have been since the days that CQC ratings were invented, then we will be saying goodbye to them. If they can't demonstrate the capacity to improve, then we don't need them anymore. So it doesn't apply to very many people on this meeting, we know, but for those that are probably not here that it may apply to, we will be doing that, and we'll be picking up the work that we started over a year ago to deal with that. And some new things. So we are going to be looking at day services for the first time to do some proactive work at looking at quality and improvement with those services. So far, we've really only had a reactive response to quality issues and infection control issues in day services, and we've had some scares as a consequence of that. So we feel we really need to be more proactive with that, subject those services to a routine audit. So we'll be bringing that in during the course of this year as well. It won't be early this year, but it will be later on this financial year. And finally, and most importantly, I guess, is for us to get some formal feedback from you, which is again something we haven't done. We've failed significantly in not doing that in a formal way. So we are going to be seeking your feedback to the way we do our work. So we will be circulating a very brief and easy to complete survey after we've completed the PAMs, before we get the report, just to comment on how we did at the visit. And we hope you'll enjoy doing it, because it's a bit of fun as well. But it's really important for us to understand how those visits were for you, because it's still opportunity for us to amend the way we work, particularly focusing on the fact that we're working in a different climate with COVID. So it doesn't go away, it's still there. We need your feedback to improve the ways we're working, particularly in a COVID environment. So we'll be seeking that as well. Final thing, Irene, I'm not sure if she's on the call, she did remind me during the week that I must make a mention of this, and we did email providers earlier on in the week about this one. So it is just to draw your attention to the clinical leads questions, because we know we had some really dramatic decrease in the way that the capacity tracker was being completed since May, I think, which is when we first, can anybody remember May? When we first circulated the list of clinical leads, and we got a phenomenal rate when, to the capacity tracker at that point. We were well up in the 90s. Most providers said, yes, we do know who the clinical lead is. Then they changed the question to say, do you know who the clinical lead is, and do you see them? Of course, then we got some different answers, because we know providers weren't seeing them all the time. So there was a lack of uniform reporting there. But suddenly, almost inexplicably, we've got some real drop in Norfolk, and we are an outlier in the east of England with this. We've got really low numbers of providers reporting that they know who their clinical leads are. So we did circulate some information earlier in the week. If you haven't found that email, I would just draw your attention to it, please, because it does give you the detail of who your clinical lead is. So there should be no real reason why you wouldn't answer yes to that question on the capacity tracker. Of course, with the second question, that's still to be determined. If you have seen your clinical lead and you do see them, you engage with them on a weekly basis, because that is the determination made by Department of Health and Social Care that is what clinical leads will do. They will engage with your service on at least a weekly basis, that you can report that accurately as well. We'll look at the feedback. We do look at it. I can see the tracker right now. If I wanted to check, I'll know what your position is on whether you've seen your clinical lead. I would invite you to keep that information current, because we do use it to feed back into the CCG. With half of my CCG head on, I will feed back into the CCG. So if you don't hear from your clinical leads on a weekly basis, that will be followed up. The only way we will know is through the capacity tracker, so please do keep that bit up to date. We really appreciate it. We will take action on it. I'll give you my assurance on that. And finally, shameless plug again, follow us on Twitter if you don't already. Don't follow Norfolk and Suffolk Care Support. They've got enough followers. Follow us. Thank you very much. I'm really happy to take any questions if anybody has any.
Thank you, Tim. Thank you. Follow us both. We're very democratic here. So thank you very much, Tim. That was really, really helpful. There's been nothing put in the chat box as yet, but I think for people just to think about what Tim said, are there any questions that people would like to ask Tim regarding the PAMs, coming back face to face, shall we say, rather than virtual? Are there any questions from providers about that? Please, this is your time to ask.
Yeah, do jump in.
Yeah. And I don't know, Raj is on the call. Raj, are you there?
Yes, I'm here, yes.
Yeah, so have you had a PAMS visit before?
Yes, we had, yes.
Yeah, so from your perspective, is this good news? Is this something that that you feel would be very helpful?
It is helpful, no, because there are things, no, you can, because with the time, things, no, it's certain things you miss out, no, and just being a reminder, it becomes a routine for us, no, carrying on, and it's just a reminder that no, oh, you could be missing to it, or you could improve on this one, no, that's all helps, right? Because it's as we get used to doing same things over, and we miss a point, and then we never look at it. No, that's my point. But it's all there. We're ready to take improvement. There's always a good way of suggesting something you may be missing from the gap. Yeah. Okay. So I think it's very helpful in that sense. Yeah.
Oh, that's great to hear, Raj.
Yes.
Anne at Dorrington House, are you there? Are you able to come in? No, maybe not. Maybe let's just try Tracy then. Tracy Butterworth, are you there?
Tracy Butterworth's one of us.
Oh gosh, I'm so sorry. I'm so sorry. I picked on the wrong person.
Don't feel sorry for me.
Tracy should definitely give us a good report. How are the PAMs, Tracy?
Perfect. They're great. They're a great tool. Yeah.
Yeah. So have you done many virtual sessions during this period then?
I've done quite a few quality monitoring visits virtually, but obviously no PAMs as yet.
Yeah. What was that like?
It's good in terms of actually seeing people, but you don't get the proper feel for going out to actually meet and speak to people in person.
Yeah, sure. Now, before I embarrass myself again, is Ruth Walker there? And Ruth isn't from your QA team, is she?
She's not, no.
No. Ruth, are you there? No. Well, I'm finding that people aren't sort of unmuting themselves. So, Trina?
Yes, I'm definitely here. Thank you.
Oh, Trina.
Thank you very much. Happy Easter to everybody, anyway.
Happy Easter to you, Trina.
So the only question I've really got is how much pre-paperwork is sent beforehand? Because even doing that is very time consuming with archaic equipment that's sometimes a bit temperamental. I know there is a lot of paperwork that needs sending over, but to scan it and email it across is also very time consuming for us as well. So do we get a large window of time to produce this to send it?
Yeah, we certainly don't want to put providers under a huge amount of pressure to produce a huge amount of data to us electronically, particularly if you've got, like you say, archaic systems. And it's really great that your boss is on the line, because he can hear that you've got an archaic system and he'll do something about that. He'll definitely want to support you with that, to bring your archaic system.
Temperamental Wi-Fi that's the problem. It's very rural and it kind of drops off. We've got all electronic equipment that's Wi-Fi run, and if the Wi-Fi then stops working, so does the printer and everything else that goes with it. So yeah, it's more of a Wi-Fi issue than the actual electronics that we're using.
Sure. Okay. So there's two answers to that question in a way. So one, we're certainly not going to make it overburdened. So I'm not going to ask you to send anything that would be just as simple for us to look at when we get there. But at the same time, we want to balance, what you're really capitalizing on our time on site. So if there's any information that you already hold electronically that would be easy to share with us in advance, that's really the kind of stuff that we really want shared in advance, because it's pointless us sitting looking at your computer. If we can look at it off site, that's
exactly
one thing.
That's perfect. We didn't want you to say, well, by the end of the day you've got to send all this in to us because we're coming tomorrow. You think, oh my goodness, it puts us under a bit of pressure.
want clever solutions to that. So that's one thing. And then in terms of the timeliness, we're always going to give guys at least 2 weeks notice. So we could give you longer than 2 weeks, but the minimum is going to be 2 weeks. So that hopefully will be enough time for you to be able to get things.
Most definitely. Yeah, that's absolutely fine. Thank you for clarifying that. That's lovely.
Thanks, Trina.
Thanks, Trina. Veronica, are you there?
Hello, Christine.
Hello, Veronica. Have you got any questions, or are you? What's your feeling about having PAMS coming back?
We haven't actually had a PAMS visit, but from listening to what everyone's saying, it sounds as if it'll be very beneficial. So
yeah.
We haven't even paid them to say that. We haven't even paid them to say that, honestly, Veronica. So we're looking forward to we're looking forward to coming as well.
Yeah, no, I think it will. I think it will help all providers. One question I do have, though, it's not related to PAMS, but you're saying obviously PAMS, you can start doing home visits and stuff. Does that mean that when we phone social services, they're going to all be back in the office as well working? It is difficult to get hold of anybody.
Well, okay. Well, I'll certainly give them that feedback. Perhaps we should catch up afterwards, because if there's particular people that you're struggling to catch up with in
it's just if we're trying to get increases or anything for any clients, we seem to have to go through so many different people before we can get put through to the right one, because they're all working from home.
Okay.
That's
Yeah.
the only thing.
So in actual fact, there shouldn't be any difference, because we've got a really fully integrated IT system. So when you call county, let's say you call County Hall, the number will be put through to a phone number, to the same number that I'm sitting on at the moment. So the number would be the same whether I was sitting at County Hall or sitting in my loft, as David referred to it earlier. So so that should be the same for all colleagues, because we're all working on exactly the same system. So if there's a problem getting a hold of people, it's probably because they're actually they're working more in a more agile way. So they may not be working 9 to 5 as you might expect them to if they were going into the office. So that might be more what it's about. It shouldn't be about IT problems. But I'm happy if you want to catch up with me, because if there's it sounds like if you've got particular requests around fee increases or something like that, then I'm happy to catch up with you afterwards, and we'll work out.
We've got them all solved now, Tim.
Oh, you have.
Okay.
Okay.
Yeah, we have got them solved, but thank you.
Okay, so listen, I want to say, because this is a more general issue as well for any other providers on the line, that if you know who your quality monitoring officer is, and hopefully you should do. If you don't, we'll circulate that information. But do use the team if you're struggling to get hold of other people in the council as well, because we are happy to act as a conduit if you're struggling, and we'll put you in touch with the people that you're otherwise struggling to get hold of. Particularly if you're finding it a trial to come through the front door, we recognise that can be problematic. But we are here for our providers, so that's you. So if you're struggling to get hold of anybody in the council, then do let us know. We'll see what we can do to help.
I'm not sure who our quality officer is, so how would I find that out?
And I don't know which service you're from either, so I can't tell you until I look you up afterwards. But if you want to, I will look you up. Are you a registered manager?
No, I'm the care manager.
But you're not registered. Are you happy to tell us which service you're from?
Yeah, it's Manacott Home Care, and our registered manager is Shona Gordon.
Okay, that's fine. I can. I'm not going to stay. I was going to take an educated guess at who your quality monitor is. I'm not going to do that, but I will contact you after. I'll drop you a note to this email address that you've dialed in from.
That'd be perfect. Thanks, Tim.
Yeah, I was going to say that if people want to put their emails in the chat box, that'd be really helpful, because if you want a copy of the presentation, that's easier for us to actually extract your emails from the chat box than us to have to go back and try and work them out via Teams, which is it can take a long while, and sometimes it doesn't actually work either. So if you want the presentation, please can you put your emails in the chat box? That'd be really, really helpful. Can I also just ask, I noticed Katrina's on the call, Katrina Brady. Katrina, can I bring you in, because obviously you've got Norfolk First support, haven't you? Yeah, hello Katrina, long time. Yeah, and to hear from you as well, Katrina. Haven't seen or heard from you for a long time. So from your perspective, from Norfolk First support, how does the PAMS help with you?
I think that we have a close working relationship with the QA team. We've also got on this call Andrea Borwell, who is our QA manager. So we have that continual oversight, which is obviously important. As you quite rightly said, everyone's focus has been towards infection control, maintenance of business continuity in very strange times, but also not taking our focus away from the maintenance of quality assurance, making sure also what has been particularly demanding for all providers, I'm sure, over the last year is keeping up with the continual stream, quite appropriately, of additional information. So it's making sure that we've been very grateful to have Andrea on board this year to keep in touch with us, to make sure that there's nothing that we miss. I live in fear that I've forgotten to cascade something or I've missed something, and I'm sure people would agree, the sheer volume and change that has occurred in regulation over the last year to keep everybody safe, whether that's been from a PPE perspective, maintaining the quality of PPE, the delivery of the vaccinations and also of the testing. It's almost that we were very aware that we had, and this is speaking for all providers, so feel free to disagree with me, but all of us have tried to keep on top of what was already a very busy and conscientious day job. And then, say, the pandemic came along and tested us severely, but it has meant that we've had the space and the time to really scrutinise our processes and make sure that they are in line with the original commitments to providing an outstanding service, let alone actually then trying to do it in pandemic situations. But it may well be worth Andrea joining, because we've also got Helen Stokes on the call. I manage Eastern Norfolk First Support, but not the rest of the county, and also, like I say, they have a wider remit than I do.
Yeah.
Want to add to my comments?
Yeah, Helen, it would be great to hear from you, because I haven't seen or heard from you for a while either.
No, I think last time I saw you were collecting an award. Yeah, I think it'll be really helpful to have people on site, particularly in our ABR units. We are supported, as Katrina said, by Andrea, who comes from the QA team originally, so we are really, really lucky. But it is that juggling of balls, and to be, one day is this, one next day is that, and to have someone come in and say, yeah, you're okay here and here, but this and this, and just refocus you on the unit, because it is really difficult for all concerned to have these conversations when they can't see what you're talking about, and sometimes that discussion about what's a really practical answer that works and is compliant is really useful. So we're looking forward to having someone on site.
Thank you, Helen. And is there anybody, who else did you say? Oh, I've forgotten already.
Andrea Borwell.
Andrea, of course, Andrea. Oh, Andrea.
Hi, Christine.
Hello.
How are you?
I'm fine, thank you. Hi, Andrea. Oh, it's lovely to hear from you. How are you?
No, I'm good, thank you. And I think, as the team's been saying, it's been quite a challenging year in lots of ways, trying to keep up to date with what's going on. I have to say my previous training in the QA team definitely has given me a good stead of what to look for and how to go.
I bet it has.
But nevertheless, welcome them on board. As soon as they can start visiting. I suppose for me, I know Tim's talked a lot about residential settings this morning and day services. How are you planning to do home care providers?
Yeah, so we will be. We're starting generically, so we will be looking at home care as well. It will be the same. We'll need to do a little bit more thinking around how we're going to get our evidence in terms of people that use services, though. So in terms of where we might normally tip up to the homes of some people that are using services, we'll need to think that one through a little bit more. So we might be collecting evidence in a different way there. But in terms of our the on-site part of a domiciliary care, home care provision bit, we will be going back to do those as well. So the risk assessments will be the same, if not similar, probably the same. But yeah, it's across the piece, Andrea. So yeah, everybody will be in.
Look forward to it.
Yeah. Lovely, thanks, Andrea, and great to hear from you. Great to hear from you. And Janine, I've got you. You put your hand up, and you put your hand up physically. Come in, Janine.
I was just wondering whether your visiting teams are going to be vaccinated before they go into the home, because so are you eligible to have a vaccination?
Yes.
Because you are, and because otherwise then I'd be concerned, and that you would have your lateral flow test on the day that you're going in.
Yes, we would. And Dr. Smell, you failed the test because you obviously weren't watching that presentation. Maybe was it you that took my presentation down just at that critical moment when I was on that slide?
But if any of your team
Yeah, I
haven't
did
had
say
their
that.
vaccination, please, there's a drop-in centre tomorrow, a
Yes.
clinic tomorrow.
There's one today as well.
There's
There's
two in Norwich. Yeah. So I just wanted to just make sure that we keep everyone safe as well.
Yeah, of course, no, absolutely no. And I did say in the slide, the slides will be circulated afterwards. All providers will have my 100% assurance that all of our staff will have had both of their vaccines before they turn up, and they will be more than happy to wait for 30 minutes while the result of the LFT comes in when they turn up at provider services as well. That's absolutely what we're lined up to do.
David, did you want to come in as well?
Well, if you don't mind me asking, Tim, I mean, this sounds like a really good service. You mentioned initially that a proportion of care homes do need support. You know, there are a number who require improvement. With this service, are you actually going to these care homes in particular that require support to offer this service? Or is it a service that depends upon the care home contacting you? Or will they be proactively, in a sense, given the opportunity to get this support?
What a lovely question. Thank you, David. So the answer is that we'll determine our audit schedule, and we'll do that. There's a number of factors that we use to do that. So at the moment, because we've not done any audits of this sort for a long time, we've got a bit of a backlog of care providers that we're really anxious to get out to. Some of them sitting in that requires improvement bracket, but there may be some that are actually rated good by CQC, but their last inspection was many years ago. So we've got some that are last visited by CQC in 2018. I can't even remember 2018. So you know, so we really feel that it would be useful for us, and some of those providers have also approached us. So some providers do approach us and say, look, we really love a PAMS because we think we're ready, and we want a final independent eye on what we're doing before CQC turn up, so that we can deal with anything that's outstanding. So we listen to providers' requests, but actually the way we determine our prioritization is based on a number of factors, and it may include a request of a provider to come out. But on the whole, it will be risk-based. It's based on our last PAMS visit and/or the regulator's last CQC visit, and other factors as well. So there may be safeguarding referrals that come into the council also come into my team if they relate to a care setting. So we look at those. We look at complaints that come into the council, and any that relate to a care setting also come into my team. So it's a multifactorial kind of prioritization scheme. But you know, it's an open and transparent process. So we'll always explain why it is we're coming. And we'll share where we can, where it's not subject to safeguarding, what our concerns are, because we'll be focusing on some of the concerns inevitably when we get in there. But it is a global visit in the same way that CQC visit across multi-factors. So we're looking at the environment, we're looking at feedback from people that use the service, we're looking at the way the records are kept, we're looking at some clinical considerations, particularly in nursing homes. So we'll take one of the nurses with us when we go to a nursing home, and it's a global audit. But yeah, to answer your question, we've got a lined up prioritization program, and we've got a little bit of a backlog of services that we want to get out to first, because we think they'll benefit from our engagement at this point.
Yeah, thanks very much.
That's brilliant, Tim. Thank you. I'm just going to move us on a little bit, because I did invite our public health colleagues who I failed to introduce, and I apologise profusely to you. So can I introduce Boyka first, Boyka Rochelle, and then Andrew Rogers. Are you able to come in, Boyka?
Yes, good morning, everybody. I'm Boyka Rochelle. I'm a physician and consultant in public health medicine, and I've been working with Tim Weller's team, QMOs and CCG colleagues during this pandemic to prevent and control outbreaks in care homes. So it's been a pleasure working with you all. Thank you.
Thank you, Boyka. And Andrew?
Good morning. Yes, I'm Andrew Rogers, and I'm the head of operational COVID testing for Public Health Norfolk. In particular, focusing on the county's community testing program, which is the district mobile ATS teams, also the workplace surveillance testing, workplace collect, pharmacy collect, and the schools collect bubbles through the libraries, etc., etc. So we've got quite a large volume of people testing. We've got circa, well, in the workplace, for example, we've got about 300 companies from early years up to businesses like Lotus testing. And then we have the district teams, which go out in all the districts and have 2 to 3 sites every day. And then we also have all the other channels where we deliver test kits to people at home and via the library model, of which you can get them at 21 libraries at the moment and up to 47. So the main lead is community testing and asymptomatic testing, but obviously we do link into the PCR testing. And we do have certain capabilities to help and support particular settings on a sort of exceptional basis, sort of pre-outbreak or when they've got particular problems. Care homes, obviously, as one, being very high on Louise Smith's priority list on the strategic testing priorities. Sorry, that was segued a little bit from an introduction into a.
No, that's it's good to know what your role and your remit is. So as you're here, can I just ask people that are attending, have you got any specific questions for Boyka or for Andrew, particularly I would say around testing, but outbreaks or any issues at the moment you may have? For example, some of our registered managers meetings have reported back sort of slight conflict between track and trace information that's given to them and guidance and so on. And I mean, I'm still getting queries around the 90-day, if we want to call it the 90-day rule, when somebody's tested positive and the gap between retesting again, and that is PCR and LFD, and people think it's just PCR and not LFD. So those kind of questions. So I just wanted to ask the group, have you got any specific testing questions that you'd like, or anything in relation to outbreaks? Do come in. If not, what I can ask, I'm going to ask you again, Raj, can I just ask how you are? I'm going to move on to vaccinations because this is still related. Raj, how are your staff with first vaccinations and second vaccinations? Where are you with that process?
We are all done. First one, we had one person who wasn't willing to do it, but eventually got her to do it. Yeah. So the next, so we are all fully compliant on that basis, and we got the second one due on the 13th and 14th of April. So this is so that'll be the other everyone done on that basis.
Excellent, Raj. And is that residents, are the GP PCNs coming in to do the vaccinations for the residents? Yeah. What about your staff?
The staffs have to go down to Fakenham Centre. That's where we were allocated. No, I don't think the surgery had the service for the staff. So basically, we were asked to go to the Fakenham. So everyone, went up there. Okay.
Okay. And they've got their second vaccination date, have they?
Yeah. All given to them. Yes.
Fantastic, Raj. Well, that's really good to hear. Apart
from the one person who wasn't done, that person I need to check up whether when is the second date given here, because there's a time gap on that. Yeah. So it may have. Yeah. So
lovely. And I'm going to put you on the spot, Raj. Capacity tracker. How are you doing?
I'm doing it. I mean, I do most cases. I do on a daily basis. There might have been 1 or 2 times I may have, kind of missed it. Because it's not. I got busy and then just found that it was too late and it's gone 12 o'clock in the morning. Something like that. Yeah, next day I tend to then do it. It's question of it's there, but you get tied up and you haven't had time to visit your PC to add on.
Yeah, no, and I think we all recognise that, you know, that you have to prioritise, but as long as you can keep the numbers in there, that would be great. Because Hannah, can you come in and just explain the addition about the capacity tracker that's going to happen? I think it's mid-April, isn't it, around recording second vaccinations? Are you able to come in and explain that?
Yeah, so it's really important, as Christine says, to update the tracker, because it is something that we look at on a regular basis, and it's really to try and help you as well to understand if there's anything extra we can do to support you to get the vaccine. And Tim's just really helpfully put some data in the chat box on uptake levels. So as Christine said, in April there is going to be the reinstatement of the second dose for the COVID vaccine. So you would have noticed that originally it was on there. I think probably last year it was on there and then it disappeared. So that's going to go back on there. So as soon as that's on there, I think it's the 12th of April. Great if you can start filling that in. There is some Q&A sessions that happen weekly that are held by the next team. So that's the capacity tracker team, the central team. So I can pop those details into the chat. We're going to share those with providers via our comms, but I'll pop those in the chat as well. And that's just a chance for providers to drop in and have any questions answered that they may have about the chat and about the tracker, sorry. So yeah, so they'll be coming on board soon. So I'm happy to take any questions as well if anyone's got any on the capacity tracker, and I'll try and answer those.
That's great, Hannah. That's really, really helpful. I think the most important thing for the providers on the meeting is to understand we've got the people here that can support you and connect you and answer some of the questions. The capacity tracker is going to be added to I haven't got the date, Hannah, I don't know if you've got the date, but it is going to be added in mid-April to capture that second vaccination information. And the reason that Tim has been able to put those percentages in there, partly the staff one in particular, is because of the capacity tracker. So we're absolutely delighted, aren't we, Tim? And I know David and Janine have worked really hard as well with us to get people to take up that first vaccination. It's you know, it's moved enormously, really. We were 70% for quite a while, so it is moving absolutely in the right direction, which is fantastic. And I don't know, is there any provider on the call that has got a sort of persistent number of staff that are still refusing the vaccination? It might be useful just to have a sort of feel about numbers here, or are they sort of just one or two? Because that's what I'm getting back, Tim. It seems to be one or two people within an organisation that are, you know, quite entrenched in their views. I'm just gonna, Georgina, you've joined us. Georgina, would you come in? How's your vaccinations going? Are you able to unmute, Georgina? Or maybe not. Trina?
We've had a really good uptake from both staff. All the residents have been done in all 4 homes, and out of 105 staff, there's only 7. But we're still working on those. But some of them have got, one had an allergy and didn't know whether she could have it. So we're looking into these and laying their fears. So we're aiming for 100%, but at the moment we've had a really good uptake. So, well, as you say, never say never. We might get to us 100%.
Yeah, that is really, really good. And the fact that you're working with those people and talking to them, because what we found is it's the conversations, isn't it, that makes people change, and just listening and people not feeling bullied into it, basically.
That's right, it's more supportive, because we don't want to come across as being bullying, but they've got to understand that if there is a change in the law and it's compulsory for having a vaccination, then it puts their question of employment at risk. So we want to allay their fears before we get to that level, really, and get them to take it voluntarily.
Yeah, absolutely. And there's a webinar coming up, I think it's next week, check the e-bulletin, which is about compulsory vaccinations, and it is discussing this about whether it will, won't, how it might work, won't, etc. So there is a webinar around this, because obviously there are legal ramifications for this as well. So it's not a given that this is going to be compulsory, but there's a lot of noise about it at the moment, about, as you know, Manchester put it in their contracts, no jab, no job, their sort of headline. So it is really useful to have the conversations to clarify what the legal position is, because I know from talking to other registered managers, they think that's the green light for putting things in contracts. Well, it hasn't been tested yet, and there's lots of discussion still to be had on this. And I know, Tim, with your hat of your legal hat, I'm sure you'd agree.
Absolutely, yeah. It's by no means, you know, somebody can put it in a contract, but that will be tested. That will be tested. There's no two ways about it. So it won't be until it comes to a court, probably at some point, to know whether or not it's going to be a sustainable solution for employers to just add things like that into a contract. It may have there may be a different bearing in relation to new staff. So if you to advertise to say that new staff coming in needed to have a vaccine in order to be eligible to be working, that's one thing, and that's probably a more tangible option. I think in respect of existing staff, though, there's an entirely different kettle of fish, and that is yet to be tested. So yeah. So I think that the things that people are saying at the moment, which is about encouraging staff, making sure that they've got good information coming from reliable source, because that's a really key thing still at the moment. There's still a lot of really spurious information out on the net, and particularly on social media, that's alarmist and frankly inaccurate, and sometimes really obviously inaccurate, but sometimes only subtly inaccurate. And I think that's the thing that, you know, so focusing people on reliable sources of information, speaking with knowledgeable people, experts locally as well, that's what's really going to drive people to make sensible decisions, I think.
Yeah, thanks, Tim. Thanks. I was just going to pick up about testing now. Obviously, things have kept changing and so on, but I just wondered about visiting care homes in particular, about how that is going, how the whole process of visiting is going, how you're managing the testing, and whether or not you've got any issues at all with people coming into your care homes, any unforeseen consequences or issues. It would be really good to hear how it's working in practice. Does anybody want to come in and just say what it's been like for them? Everybody's very shy today. I think they're looking forward to their chocolate eggs this weekend. So that's all I can say. Raj, I'm sorry to pick on you again, but you're very good, Raj. How are you still there, Raj?
Yes, I'm here. Yes.
How's it going in your care home with the visiting?
It's started gradually, and there are, as I said, there'll be families which are more interested in doing, and some you don't have. So you have a regular people coming in, which I have. So it's started, gradually. Everyone's coming up, and we're just giving the appointments based on our workload and so on. So they're coming. Yeah. So it's happening.
It's happening, and I'm just interested. What's the sort of response been from families as well to this this opportunity to come in and visit their loved ones face to face?
As I said, there are more. Funny enough, not everyone has got a relatives, right? They have.
No.
Yeah. So question is, the people who have relatives, or daughters and sons, they're quite keen on doing it. So the input is more from that side than the people we never had. So
yeah.
So it's not that it's 100% that everyone had a visit, but it's more of say 60-40 that way at the moment. Yes, okay, in my home.
Yeah, lovely. Yeah, and of course, not everybody does have that opportunity. What have we got here? We've got something in the chat box. Oh, Janine, Janine has very kindly put in the chat box here where the vaccination drop-in centres are as well. Vaccination drop-in clinics in Norwich for all eligible adults, health and social care staff and 50s tomorrow, Friday the 2nd of April, 8 till 6 p.m. at Lionwood Surgery, Wellesley Avenue, and Gurney Surgery, 40 Fishergate. Please spread the word. So if you've got anybody in that area, they're drop-in centres. Janine, you don't even have to book, do you? It is, as it says, drop in.
Yes, just drop in, and it's the AstraZeneca clinics. So you don't need to worry about allergies. So if you've got anaphylaxis, that's a good one that you can come to an AstraZeneca clinic.
Yeah, so if you've got any staff, the people that are left on the call that are sort of wavering and they want the vaccine and have decided they want the vaccination, live nearby, drop-in clinics are also available. So yeah, please spread the word.
Yeah, and if they're due their second doses with AstraZeneca and they haven't got a date, again, it's an AstraZeneca clinic. So if they're sort of a week or two away and they're worried, again, they can have a second dose as well. AstraZeneca.
Oh, that's fantastic, Janine. I didn't realise that. So second doses as well. That's fantastic. Yeah, brilliant. Because
if they're due,
if they're due, that's right. Yeah. Exactly. We have had a few registered managers contact us because they're very close to the 11 weeks, very close, and they're concerned about the second vaccination. So that, you know, this is good. This is excellent news. Oh, thank you. Well, the time is 11 o'clock. We've still got a little while left. Is there anything anybody else wants to talk around testing in particular? I'm very interested in, because of all the changes with testing. Are people getting results back on time? Are there any issues with the testing? Are you getting your LFD tests, on time? A lot of this was a problem, I would say, at the peak of infection, and I'm sure, Boyke, you would agree that that is declining now. So perhaps things are levelling off somewhat. But from the homes that are left here, and home care, have you had any issues with your testing and getting hold of kits at all? I think Helen, are you there, Helen Gosling? Are you able to come in?
Hello.
Hello, Helen. Hello. What service are you from, Helen?
Castle Meadow. I'm one of the regional managers.
Oh, Castle Meadow. Oh, fantastic. Oh, hello, Helen. That's really lovely to speak to you. I should have recognised the the connection. I'm sorry about that. So how's testing going for you in your care homes? Because you've got residential and nursing, haven't you?
Yes, that's correct. We haven't had any problems. We've been able to get the tests quite early on last year. The lateral flows we're using it for visitors as well at the moment, and we've not really had any problems as a group.
Right, and how's the visiting going?
It's quite interesting, because before we had the contact visiting, we did have families complaining. Yeah. And raising concerns, and now we've given them the option of contact or non-contact. Quite a few are opting for the non-contact still, and the concerns and complaints have reduced. So, yeah.
I suppose it's always about giving people an option. I suppose that's the lesson. But yes, I wonder. I suppose you've got no idea, unless you ask people, why they don't want to visit face to face.
Some families have actually said, I don't trust mum or dad, that they won't understand that I can't hug and kiss them. So they've been very responsible and
yes,
and taken that responsibility, and abiding by our visiting rules, if you like, our codes.
Yes. Yeah. Have you got a visiting policy, Helen?
We visiting policy, and we have like a visiting code of conduct as well.
Yes. Excellent. Yes. Yeah. There was. I think we distributed the information that was provided through the Care Provider Alliance, which was a whole series of documents which included a code of conduct as well in there, which sets out, doesn't it, about what you'll do, but what you expect visitors to do. Yes, exactly. I thought that was really good, actually, Helen. I think because it's very difficult, isn't it, when you're inviting people in the care home? You still have to be very careful, don't you?
Yeah, we're still using our booths or pods, whatever you want to call them, so that there's a designated area which we can then clean down after and in between each visit, so they're not actually coming into the care home as such.
Oh, okay, so you've not gone into people's rooms, you've not opened up that option yet?
We do on an individual basis, depending on, so you know, like for end of life, or if somebody is being cared for in bed, or if it would be too distressing for them to come out of their room for whatever reason, then that's looked at individually.
Okay, yeah, okay. And as you say, families have been very sort of supportive of that.
They have, since they've had the choice.
Yes, yes, exactly. Well, that's excellent then. And so in terms of your own staff testing, that's working well?
Yeah, that we've not had any problems with that throughout, really. All the staff are very compliant and are keen to, you know, to do it. Not really had any problems. Not really had any problems with vaccinations either.
That's good.
We've been very lucky.
So again, your second vaccinations are coming up or have started already, is that right?
We've got 3 homes which have had their second vaccinations, residents and staff.
Excellent. And staff?
And Suffolk.
Ah, excellent, excellent. And have you had any issues about staff getting second vaccinations or not being clear where to go?
No, they've all been done in the care homes.
Excellent. Fantastic. Oh, that really is good. Do you think that's made a difference with take up?
Yeah, definitely, because to begin with, we were given options for the different hospitals. That wasn't taken up. Some people did, some people weren't so keen because of the travel and because of obviously where the hospitals are situated and where people are living. But as soon as it came to the care home, then yeah, that really good take up.
Yes, I mean, it's something that I hear regularly from care providers, and really, if you think about it, if you don't have to travel and you see other people being vaccinated, there's a bit of a sense of community around this, isn't there? So sort of peer-to-peer encouragement for those that are maybe a little bit tentative. Sort of nationally, this is what providers are saying, that where the vaccination has been offered actually in situ, it's been fairly, very, very successful. Where people have had to travel or go off to PCNs or GP practices or hospitals, in the first instance, it was less take up.
Yeah, I have to say that the surgeries have been really good as well, because we have had some outbreaks in some of the homes. And
yes,
you know,
of course.
You can't vaccinate after so many days. You can't have a vaccination. So they're even like planning when to come back to pick up the people who have been overlooked or missed or anything. So yeah, it's been really positive.
So that's also really good. You've obviously got very good relationships with your GPs and PCNs as well.
Yeah.
That's brilliant. Janine, you've got your hand up. Do come in.
Yeah, I was going to ask a question, because I went into one of our care homes a couple of weeks ago, and some of the staff were very reluctant to have their second doses because they'd had reactions with the first dose. So, and what we found interesting is that the elderly, the residents don't seem to really have much of a reaction at all, but quite a lot of the staff had a temperature and had been unwell for a day or two, and they were really concerned about having the vaccine and then not being able to work the following day. So 2 or 3 of them said no, but we'll have it next time you come because I'm off the following day, etc. So is there some degree of sort of planning going on with the care homes, and is there assurance for their staff that if they are off the following day, they don't need to worry? Because I really got that impression with 2 or 3 of them. The other thing to say is that it's really important then to, when we go around the second time, just to make sure that the staff are not actually pregnant, and if they are pregnant, to have a chat to us about whether or not they should have the second dose or not, because we are offering it to people who've got other risk factors. So if they are also high BMI or also diabetic, etc., then we would balance the risk and say have it. But if not, we would then say to delay.
That's really helpful. I noticed, Helen, you've got your hand up. Helen Stokes.
Yeah. Hiya, thank you. Couple of things. Excuse me, I have got a cold and I know it's not COVID. Was that I had my first injection at Grays Fair by you, Janine, I believe. And I was quite poorly. I was actually sitting at work thinking, I was really pleased I feel poorly while I'm working, because I'd be really fed up if I was unwell at the weekend when I'm off. And when they said to me for the second one, or same effects, I was thinking, oh rubbish, a Saturday tomorrow, and I was fine. I didn't have anything, so is that. But one of the things that has happened a couple of times, both at Benji Court and Grays Fair the second time, is that there was the conversations with the people, like the other lady was saying, they come to Grays Fair, conversations about when people are going to be there. They were incredibly organised. They're giving people time slots, so we didn't have build-ups of people waiting for it and that kind of stuff. And then we all got a frantic call in the morning to say, no, we've done these times, we understood they're going to be here all day, but they're leaving at 12:30, which did then result in lots of people hanging around and trying to keep people apart and stopping them from chatting and all this kind of stuff that they don't really understand, because they work every day together. So I just wondered if there was a bit of a disconnect between the booking system and the poor people doing it, who are turning up with an expectation that isn't, can't be met.
Can I just ask where that was? Is that actually at the PCN sites, Helen?
That was, this one was at Grays Fair.
Grays Fair.
Last week or the week before, something like that. And then previous to that, it was a surgery. The chroma surgery have been fantastic at Benjamin Court, and they were similar thing as to what Tim was saying. A few people got a phone call to say, if you can get here, we got them spare. And people rushed down there and they'd gone. So
yeah. Yes, yeah. I think that the problem with having ad hoc arrangements is that it is exactly that. So it's one of those very difficult things to get the messaging right, because obviously nobody wants to waste the vaccine. So the attempt is to administer as much of the vaccine as possible so there is no waste. During the day, some people will not turn up for their vaccine. So suddenly you have gaps and you have vaccine left. So one way is to contact people you think may well be able to come in and get their vaccine. So I don't necessarily know that there's a better way of managing that.
No, I think yeah. Christine, it was more understandable at Benji with people rushing down there, but the Grays Fair one was planned. And
like it was planned.
The Grays Fair one was planned. They were expecting the team to be there all day, and when the team came, they were like, no, we're not here all day. So I just wondered, because it's not good for anyone, the poor teams that turn out, the poor people who suddenly, they were trying to get people who've been working nights who they'd booked in for the afternoon, trying to wake them up and say, come quick. It's a bit of a stressful for teams that are already under a lot of stress. It's not meant as a criticism, it's just some feedback about the effect that's had, really.
Actually, is it possible, Helen, you could just drop me an email with that in, because I think it just needs to be picked up at the delivery group. And as you say, it's not a criticism, it's an observation, and something that, actually it would be very helpful if people remembered this when they're actually encouraging people to come in, especially in large groups.
Yeah, I don't want to see it as a criticism, because people have done a fantastic job. You can't praise them enough. It's just I'll drop you a line. Yeah,
thanks ever so much, Helen, and I'm really sorry that happened, really, because it's certainly not the intention of it happening like that. I'm just going to bring in Raj before I come back to you, Janine, if that's okay, because Raj, I don't know whether his arm's aching, but he's had it up a little longer. So.
All right. Okay. That's okay. Thank you. The question is for Dr. Jenny. I may have misheard what you said earlier. I did have some of my residents who had a bit of a reaction. No, I mean they were more sleepy, so it wasn't that none of them had. And my staff, most of the people had a arm ache and slight feverish, But so that's what I wanted to just highlight to you. Yeah. So.
Yeah. Janine, would you like to come in?
Yeah, I mean, we had most people's reactions are sort of quite mild, a bit of an arm ache or just mild, and they can work. But there are occasionally people who become really quite unwell with high temperature and shivering or bad headaches or migraines and things, and then they couldn't work the following day, and so they felt really bad. But I think with AstraZeneca, just like Helen said, the first vaccine you seem to have more of a reaction, and the second vaccine seems to be milder. So we can also reassure people that it's unlikely to be quite as bad as the first time, and also saying to them, at least, look, we know that your immune system's worked very well, and you've become, it's showing that you're becoming immune. But it's just that just that little bit. Some of them are concerned. They really don't want to have it done when the following day they're meant to be working, and some of them cancelled and then came. They said they would have it on another day. Yeah.
Thanks, Janine.
And then the other thing I wanted to say was apologies about us sort of, with the care homes and the second doses. There's often a plan of having to do them between this date and that date, and some people will plan to say come in next Tuesday, etc. But then what happens is that we end up having a clinic where there's a lot of where they haven't been able to fill the slots, and then we have quite a lot of staff that have been booked in to help at the vaccination centre, and they're then so that they haven't got so much to do, and then we put the teams together and send them out to a care home. So really apologies to you guys, but we're not allowed to now go down to the under 50s until we've done the over 50s and the second doses. So that there's a real mismatch between when we're trying to run the clinics, a real mismatch between the number of patients that we can book in and the number of staff that have turned up to do the shift. So really sorry about that. But rather than having them sort of twiddle their thumbs, we think, oh well, which care home could we do? And sometimes they bring one forward, and then it does become a bit of a rush, ringing around trying to get people in. So it's not ideal in any shape or form. So, but I hope that you can understand and bear with us.
Thanks, Janine. And it is, isn't it, balancing supply and demand all the time. It's and the workforce as well. It's a logistic nightmare. Can I just bring in Katrina, who's also got her hand up? Katrina.
Yeah. No, I was only going to add, I'm going to say that the way that the vaccinations have been delivered is absolutely fantastic. I'm just wondering if there may be a ripple effect. We had staff that were booked in for their second vaccination to travel to Southwold to have them, booked a lot in, and then they said, oh no, we've actually done them elsewhere. So when I was notifying that then they're not going back to the same place, they are having a like for like delivery. So we're actually, so there's a bit of a ripple effect on that, because the staff have either been approached by their GPs, or as I say, they've heard about a more maybe more local option. And it just means that I'm aware, for example, that there will be 3 vaccines that will be waiting for us that our staff now have taken up elsewhere. So I just thought it's just got a bit of a ripple effect when the second dose automatically goes back to the first venue of the first dose. So for us, it's not an issue. I was just raising it that it's potentially got a bit of a ripple effect with more spare vaccines being left because somebody has taken them elsewhere. So again, not a criticism. That's absolutely fantastic system. It's just an observation.
Katrina, you're absolutely right, and that is the balancing act all the time. We've had this as well, and in fact, there are some glitches, I'd say, in the system, in that, say for example, at the national booking system, people have booked on to have their first vaccination in, say, the Castle Mall, and when they've booked on, they have to book the second vaccination at the same time, but there aren't any vaccinations and 12 weeks on from that vaccination date, and so they've had to then book elsewhere. So that can be quite confusing for people, and I know that's that's a glitch, or because, you know, when it was raised at the vaccination group, they said that that shouldn't happen. It shouldn't, but it does. Similarly, people can say book, because earlier on there were less options. They could have booked at say a mass vaccination site, but actually their local GP surgery is a lot closer to them, so they can cancel their second vaccination and go off to potentially their GP or PCN. And you're right, then you will always have this issue with a mismatch with what you've expected to be booked and who turns up and where that vaccine is actually delivered. It's partly the result of trying to give more choice in the system, but it has got that unintended consequences, Katrina, that you know you've raised. You are right, it is happening.
Yeah,
it is absolutely, yes. Okay, I've got a couple of other people with their hands up, so let me just double check who that is. Helen, have you come in again, Helen, or
Yeah,
is that a legacy hand?
Just really quickly, because Katrina sort of nudged me, it's a bit of a personal thing, but it might be helpful to other people, is because I was one of the spare ones at Grays Fair, Janine, you weren't sure whether I'd be collected up in the second one because I wasn't a planned one. So I did book a second one, and then I was collected up in the second lot happening at Grays Fair. And when I went on the system to try and cancel the appointment that I'm due to have on the 12th, it tells me I have nothing to manage because it knows that I've had two, and I'm really quite stressed that I can't cancel the second appointment and I don't know who to speak to do that. So yeah, personally, if I know who to contact, and B, if you know, it could be helpful if we could just find a way to cancel it if you have had it.
I think there's a number, Helen. I think it's 119, but I will check that out. I don't know whether Boyka or Hannah on the call know about this, but I'm pretty certain there's a number you can call. Okay. Does anybody know, Boyka?
But in a sense, if it's an AstraZeneca second dose, you don't need to worry quite as much as a Pfizer, because if AstraZeneca is underused, it can if as long as it's not been opened, it doesn't go to waste. But with the Pfizer, is that time limited? But we do have a system now where we count up people who haven't come, and we usually have a reserve list of others that we can bring in. So you can see on the system the DNAs, we count them up, and then at lunchtime we'll ring people in to come in for the we do expect some people not to turn up. We don't want it to be very many, but don't worry very much. Your dose is very likely then to be used for somebody else or not be wasted if it's an AstraZeneca one, and that's
I think it is Oxford AstraZeneca.
It was,
yeah. So yeah, well, that's good to know then. Thank you.
Okay.